But how do we overcome a financial challenge that was made worse by COVID and inflation? Inflation that we are seeing not only in Mississippi, but all across the nation. And have you or the agency considered establishing a temporary per diem payment targeted to hospitals to help address this?
Senator, everything you've said, I have heard, not just in states like yours, but when I was further up north in some of the northwestern states, they have large spans where there are very few physicians and healthcare providers. It's the same everywhere. Distance has caused a real issue. Telehealth was a saving grace during COVID, but that doesn't resolve it all. My wife, who's an OB/GYN, tells me about how in Sacramento, California, she will see patients who are coming from the very northern reaches of our state because the facilities there are not equipped to handle the needs of an OB patient. And so what you're speaking to is something that everyone is trying to figure out. How do we get resources and commitments into these communities? One of the things we're trying, and we look forward to working with you on this if you're interested, is we're trying to make sure that graduate medical education slots, the slots where you send a resident to practice, that maybe we could try to get some of these into communities that haven't always had these teaching slots available, because the evidence shows that if you locate a student who's in the residency program, by the time they finish that residency program in that community, they often stay there and develop their practice there. And so we'd like to see, for example, if we can encourage people to locate in communities because that's where they're getting their resident training and have them stay there as a result. Other thing we're doing, again, small, but still can be helpful, our Public Health Service Corps. There are programs that we have that have loan forgiveness or complete deferral, where if you commit to 5 years of service in a underserved area, as you just described, we will pay for your 4 years of medical school education. And we're trying to do what we can to direct some folks into some of these communities. On top of that, of course, you see some of the money that's devoted specifically for rural healthcare providers. Still small potatoes overall, but it's an effort to try to keep those facilities alive.
So are you saying the temporary per diem is not being considered?
I'd have to get back to you. I'm not sure if that is one of the considerations. I would suspect that one of those issues with a temporary per diem would be the cost. Where would the money come from to do that?
But you would let us know if
Absolutely.
that's in the plans or if that's even something that anybody's working on.
We'll follow
right
up
now,
with your
'cause
staff.
we hear from the hospitals and they're thinking that may be a solution, and they ask me, and I said, well, I'll have the opportunity to ask him, so I would appreciate it if you would
We'll
get
follow up
back
with you.